Every year in Australia, around 18,700 men and their families are affected by the onset of prostate cancer. And every year in Australia, around 3,000 men die because of prostate cancer. Surely reason indeed that every man over the age of 50 should have regular checkups. And if they have somebody in their family who's experienced prostate cancer, then they should have those checkups from the age of 40.
PSA, rectal examination. They're the best indicator we've got until we get to the biopsy stage. Rectal examination is often helpful, but not diagnostic always in the formative stages.
And she said, I've got some good news and some bad news. She said, the good news is your cholesterol levels are quite good, but your PSA is rather high. At the time, it didn't concern me too much because I had no idea much about PSA. And then it hit me. He said, you've got prostate cancer. And of course, I was rather stunned then. I was just sort of more or less numb. And so I just didn't, it was just sort of in shock really, I suppose, at that stage. It couldn't be happening to me. I'm fine. I feel well. I've got no symptoms of anything. What are you talking about? It's got to be wrong.
Wayne was diagnosed just after his 40th birthday. He turned 40 and he took himself off to the GP for a general checkup in the interests of good health. And we've always been worried about his cholesterol, so the doctor did a suite of blood tests and threw in a PSA test, I think just for good measure. And we found out a few days later that Wayne's PSA was slightly elevated. It was about double what it should have been for a man of his age. So at the time, that kind of information was completely foreign. I didn't know what PSA was. I didn't know that it was important. It was really not until Wayne came home, having heard the diagnosis and told me that he had cancer, that I even really considered it. Prostate cancer, which to my mind at the time was an old man's disease, could possibly affect him being so young and so beautiful and so fit.
And it's a bit of a shock when you get told. It really knocks you down. You think, heavens above, you know, I'm going to die or something, you know. I just was straightforward. I don't muck around with words. I said, I've got the results, I've got prostate cancer, and that was it.
But 24 hours later, it did hit me like a ton of bricks. I actually broke down. And funnily enough, I broke down. I was talking to this really hard-nosed builder who jumped in his car, drove about 15 kilometres, picked me up and took me off for an ultrasound and a CAT scan. And I mean, we've been the best of mates ever since.
He put his elbows on his desk, his chin on his hands, and said, I'll tell you straight, you've got a growth and it's a bad one.
Prostate cancer is the most diagnosed solid malignancy in Australia at the moment. It's only the diagnosis of skin cancer that exceeds the diagnosis of prostate cancer. In fact, more men are diagnosed with prostate cancer than women with breast cancer. Our attitudes to prostate cancer screening and treatment are continuing to evolve. 30 years ago, prostate cancer was regarded as an old man's disease and no treatment was offered. With the PSA screening era, the PSA is the blood test that detects prostate cancer, we started to aggressively detect and treat prostate cancer. And as a consequence, over the last 15 years, the mortality from prostate cancer has dropped by about 25%.
I didn't have a PSA test until 9 months after I first asked the GP for it, because he said that I didn't really need one. And I've sort of always wondered if I had done the PSA test 9 months earlier, what my PSA reading would have been and what the outcome would have been. If it had been diagnosed earlier, perhaps there wouldn't have been any escape of the cancer cells, and therefore I would have been completely cured. But as it is, I'm not, so I'm still going through some treatment. And since the radiotherapy, which was 3 years ago, my PSA levels have gone up again, and I've since had to go on to hormone therapy.
The management of localised, that is early or organ-confined prostate cancer, varies enormously. The treatment options vary from no treatment whatsoever right through to radical surgery or radical radiotherapy. The active surveillance option is a very good option for especially elderly men with a life expectancy realistically less than 10 years. It is also good for younger men who have low-grade, low-volume prostate cancer.
This DVD is designed to assist men who either have had prostate cancer, have prostate cancer now, or are considering some form of treatment for prostate cancer. A series of experts will be explaining to you how to deal with all the problems related to prostate cancer. For example, the diagnosis of it, the treatment of it and the different forms, and extremely importantly, your reaction to being told that you have prostate cancer and learning mentally how to deal with it, and also, equally importantly, your family, how they will deal with the entire problem. That is the main purpose of this DVD, but also, apart from the experts giving you the information, a whole series of people that are survivors of prostate cancer will tell you how they survived mentally as well as physically. And I trust that you will learn that in so many cases, as in my case, because I've had prostate cancer, it really is not, as you may think at the moment, the end of the world.